Well, how has COVID, affected, our congregation? Well, when COVID hit, it became a universal problem for churches. All churches globally were just shut down, including our churches, who were just shut down completely. But most of our churches are now reopened, and we are now on a hybrid mode. But when COVID first hit, we were shut down. We could only worship virtually on Zoom. We could only worship virtually, teleconferencing. There was no person-to-person contact, no corporate worship, none of that whatsoever. But since more persons have been vaccinated, the access to come back to our various congregations was given, and now most of our churches are worshiping in person, as well as we're in a hybrid mode. Some are in person and some are still on Zoom worshiping, and yet we are also on Facebook as well. Well, I'm a bit more apprehensive now about COVID because I've suffered it. I know what the effects are. I know how it impacted me. I'm a bit more apprehensive. I'm very cautious, being among crowds of people. I'm still wearing my mask. I'm still social distancing. And I just don't want to go back and experience what I experienced when I suffered the COVID-19 symptoms. I don't want to experience the chills. I don't want to experience the loss of taste, the loss of appetite. I don't want to experience being isolated from members of my family. I just don't. Who is most at risk for COVID? Well, since I'm diabetic, I believe that those with diabetes, are most at risk for COVID. I also believe that those not managing their diabetes well. One is to have diabetes, and another thing is to manage it well. Those that are not managing their diabetes well, are also at risk for COVID because you become immune compromised. And I believe that seniors, our senior population, are at very high risk of catching the COVID virus and its variants, including those persons who have chronic illnesses, like all various kinds of cancers, whose body are now immune compromised. I think those persons are at risk of catching COVID. Why is the Northeastern District, getting involved, in health programs? Well, my vision for the district was simple, and that's to renew the faith of the congregations in the Northeastern District, to restore their lives and to rebuild the community where our churches are strategically located. And that was my vision. I want our churches to serve as the health hub in the community, leading prevention and education efforts. That's what I want, for, the AME Church in the Northeastern District. Well, that is a good question. We have just started. Many of our churches have are now part of this effort, this great effort to protect our congregations and the communities that they serve, against, COVID. On March the 19th, Brown Chapel, one of our churches in North Houston District, hosted a vaccine clinic for the community. Excellent, beautiful event. Houston Health Department administered at least vaccine to 12 members of the community who had previously not been vaccinated before. And that was a great number to have been able to accomplish vaccinating 12 individuals. 12. I have to redo that. It was fantastic working with the faith and vaccine team. Wonderful team of people to work with. Claus, Stu, Serena, Moji. They were just the best of the best. They have done the legwork. Yes, they have done the legwork for us to connect us to the government, to help us, to help us get to the next level where we need to be so that members in our community can now live.